Welcome to the Dr. Berkson's Best Health Radio Show. And boy, do we have something really fun today because Dr. David Brownstein, kind of a friend and a bro to me. He's normally in Bloomfield, Michigan, but now he's in Barbados. So from Bloomfield to Barbados. And he's agreed on the day before he leaves to go back and put his work shoes on to come on the show and tell us what are the new natural hormone therapies and what are some old ones that are proven in functional medicine to kind of start functional medicine off for the year for 2019. So welcome to the show, David.
Thank you for having me, Lindsay.
Hey, I just wanted to show you last weekend I made, if you could see here, poundage of kimchi, and today's the first day that I'm really tasting it. My house does smell like a Korean whorehouse at the moment, but it's so delicious. It's incredible. There's black Spanish radish, collard greens, rainbow radish, parsley, celery from the garden, cabbage, all kinds of things with so many herbs. In fact, I had to peel 5 bulbs of garlic so no vampires will be nibbling on my neck this month. Drat.
That looks wonderful.
And I also just wanted to tell you, I heard one of the funniest jokes ever. So some women at the gym have convinced me to go on these sites like Bumble, where a woman has more control and she can meet some guys who really want to be in a relationship. And you swipe left if you don't want somebody, and you swipe right if maybe you're interested. So you read these hysterical things on here. I just had to share this with you. I read this one where the guy says on his profile, please, no invitations for threesomes, because if I wanted to disappoint 2 people at the very same time, I would have gone out to dinner with my parents.
Now, that sounds like something out of Seinfeld with George Costanza. Sounds perfect.
Which is perfect for you and I. So Dr. Brownstein is a board-certified family physician. I love that he has this very active blog, and last year, when he had to redo his board certification, he made a proclamation that he's not going to do that anymore because it's 9 hours of testing just on medications, pharmaceuticals. And there's so many natural answers. And that's what we're going to be talking about today because David knows more in his practice about natural answers than most physicians. He's considered one of the foremost practitioners of holistic medicine. He's the medical director in Bloomfield, Michigan of the Center for Holistic Medicine. And he's lectured internationally all over the place. We met at an environmental medicine conference by Bill Ray in Houston years ago. Was it in Houston or Dallas? Dallas.
It was one of those cities.
One of those other big cities in Texas. And I had just had that fateful surgery where I had my kidney removed, and the doctor promised me he wouldn't take out my adrenal gland, and he did, and I was in adrenal failure, and I was just really floundering, and you helped me. So I asked a question, and then Dr. Ray said, did you write Hormone Deception? And everybody knew my book, and I guess it had been a pick of the year that year, and then you came up and introduced yourself, and then you helped me get my adrenals back on track. And ever since, we've been kind of like, mishpucha, which is tribal kindred spirits.
It's funny, though. Lindsay's right on that one. When we met, I felt like we had met a long time ago, and it was just an easy friendship. And we've kept that easy friendship for a long time.
And I appreciate it. You've really been there for me. And what
As you have for me.
Thank you so much, David. So you really keep up with the literature, and then you have this very dynamic practice. So we wanted to talk about what's really working in functional medicine, no matter what other docs are saying.
It's an interesting topic because I've been doing it for about 25 years, and I've written 15 books. And I recently went back and started to look at some of my older books to see, hey, maybe I should change some things or And I didn't read them all because I still remember it, but it's all true. It's all still true. It all works the same. Maybe there's some new information, but the information just builds on the old stuff that I'm still doing, and it still works. So if your topic today is what works, it's what I've been doing for 25 years. I can tell you what works and what doesn't work because I have 2 partners and I have a nurse practitioner and a PA, and we all see the same thing. We all see the same things work, and we see the same things that don't work.
what do you most frequently see, and what do you see that definitively, with natural cures, consistently works?
Well, the most common complaint is fatigue. I would think you probably agree with that if you're seeing patients. People are tired of being tired, and then everything sort of builds upon that. So I guess when I look back on things from 25 years, my first patient that I treated was my dad. And my dad, well, look, when I was growing up, my short story is when I was growing up, I wanted to be a doctor, and a family doctor modeled after my doctor. And I grew up in a conventional household. We didn't do anything alternative. We didn't take any vitamins. We didn't shun them. We just didn't do them. And we didn't go to the doctor much. We went when we were sick, and we took whatever the doctor said to take, and that was really the end of it. And I wanted to go to medical school and basically do that, what I was exposed to in my life. And so I, get my degree and do my residency in family practice, and that's all I wanted to do was family practice. And I started doing it for about 6 months. What I was taught in medical school was to diagnose pathology and prescribe the drug to treat that pathology. And then around 6 months into that, I remember I lost a few days of sleep for an unknown reason. Anxiety percolated up. And I just remember telling Allison, I don't want to be a doctor anymore, And she's like, what are you talking about? We got $90,000 in loans. That's all you wanted to do. And I said, it's terrible. I said, I can't do this for 30 or 40 years. I'm not really helping anybody. I'm just sort of managing them with drugs that aren't really treating the underlying cause of most of their illnesses. And then I'm treating more drugs with the first drugs to treat the side effects of the first drugs.
I know.
And it was bad. And I couldn't do it. So in this lack of sleep and anxiety, the short version of my story is a patient gave me a book, Healing with Nutrition by Jonathan Wright. And that was my first exposure.
Of course, he was my mentor, and it was your mentor, so we have that in common too. Yeah.
He is my mentor. So it was the first exposure I had to anything of what I wasn't taught in medical school. I took his book home and I read it till late at night. And I remember the next day I called my dad in the office and told my dad I wanted to draw a couple of blood tests on him. He was really sick with heart disease, and he had first heart attack at 40, a second heart attack at 42. He had continual angina for 20 years on 12 different medications for blood pressure, diabetes, and what was the third thing? Hypertension, diabetes, and angina. And he looked awful, looked like he was going to die at any moment, and was popping nitroglycerins like they're candy. And from what I read in that book that night, I called my dad in the office the next day, and I said, hey, come in. I want to draw a couple of blood tests on you. And I drew his testosterone level and his thyroid levels. A few more thyroid tests than I was taught in medical school to draw. And I get his blood work back a couple of days later, and his testosterone is below detectable limits. His thyroid levels were in the reference range, but in the lower part of the reference range. And I just put my dad on two things right after that came back, was natural thyroid hormone and natural testosterone. And within 7 days, his 20-year history of angina just melted away, and called me up, and after about 7 days of taking those things, and he said, I'm not having chest pain anymore. And
it's so unbelievable to me that testosterone is the gladiator hormone for the cardiomyocyte, the basic building block of the heart. And regular doctors just don't understand it. And it's an analgesic. It really reduces pain. So it protects the heart cell, reduces pain in the heart.
And there's probably 50 years of research on it out there with
and
hundreds of articles.
But if you ask a regular doc, they'll say there's no research. And in fact,
So my dad gets better, 7 days he's better. His pale pasty face turns pink and healthy looking. I'm no longer waiting for the phone call that he's dead. And I think about it for 2 weeks, and then that third week I went to my partners, who I was negotiating a buy-in for a partnership, and I said, I need to leave. And they said, what do you mean leave? And I said, I'm going to go do holistic medicine. And they said, well, why don't you do it here? And I said, I can't do it here. It was a busy conventional office. And I said, but I need to go somewhere else and do it. And they said, oh, how are you going to make money? And I'm like, I don't know that one, but I'll figure that one out. And my wife was pregnant with my first child. And so I left 30 days later and started doing it. And, it was the best thing I ever did. And so every patient since I left started to get a whole thyroid and hormonal workup. So if you want to know what works, that's what works. And every patient I see today, 25 years later, every new patient gets a whole hormonal and thyroid workup. And I look for imbalances in the hormonal pathways, and to use natural forms of things to rebalance that makes huge differences in how people feel, particularly their energy levels.
So how do you test? Do you use blood tests?
So I'll start everybody with doing what I was taught in medical school, a history and physical exam. And then I'll order lab tests to confirm or deny, what I think is going on. And when I order those lab tests on a new patient, I order comprehensive hormonal workup, which includes thyroid, the sex hormone glands, the adrenals, the pituitary, and then some vitamin and nutrient levels to look at their cofactor levels as well. And then I just start getting to work, and I call it taking out the shovel and digging around to try and figure out where they're imbalanced. And when you get the hormonal system working better or working optimally, their fatigue goes away, they feel better. Is it the cure-all for everything? No, of course not. But it's certainly a big piece of the puzzle of trying to achieve and maintain your optimal health.
A big part of my mission is letting people know that hormones aren't just about sexy and reproductive things, but they really send signals to tissues all throughout your body. They're really your major physiologic internet system. And I had a very interesting story because I go around lecturing, and I met this ex-orthopedic surgeon who told me his story where he just couldn't do surgery anymore. It was so demanding to stand up. He'd been in it for years. He just didn't know what was happening to him, but he felt like he was suddenly aging. He'd been an athlete all his life. His wife was an athlete. He was gorgeous to look at, but he said he couldn't maintain what he needed to maintain for his patients. And he closed down his orthopedic surgical practice only to bump into functional medicine after that, discover that he was insufficient in testosterone. And when he went on testosterone, it was like the light bulb went on in his body. He probably would not, if he found testosterone before he closed his practice, he wouldn't have needed to close his practice down. And it was a huge deal. It was the difference between being able to continue what he was trained and what he loved versus not. And yet, so many people miss out on this.
You know what? I've seen that same story play out in many different ways. And it's really a miracle treatment for men and women. And women need smaller amounts of testosterone than men. They need it as well. But a boy and a man, it can be the difference between happiness and sadness. And, like you said, the ability to continue on in life at the level you want to continue on.
This last week, I did a radio show, and I'm giving a free ebook on the use of testosterone replacement in breast cancer patients right when they finish treatment, because testosterone in the breast reduces proliferation. It's a protector of breast tissue and prostate tissue when it's in the right levels between your aggressive hormones and your protective hormones. So this is well documented in the literature, and for some reason it doesn't enter mainstream, and patients go and ask their doctor if they're a candidate or what they should, or if they run their blood levels. If they're at the low level but still within range, the doctor says you're totally fine. And the patient's at the bottom of the totem pole and misses out most of the time.
Well, it's true. I mean, look at the breast cancer patients. They're told we have 1 in 7 women with breast cancer, and they're told, no more hormones for you, with that diagnosis, that it's incredibly poor guidance for them. And, their lives can be miserable,
fat, exhausted,
hot flashy, and all that stuff. And, it's really sad. It's really sad what's happened. It's the same thing with men with prostate cancer. They become miserable as they're put on the anti-hormone medications that actually drop their testosterone levels to zero. I've had guys tell me they'd rather just die from prostate cancer. They can't stand feeling that way.
So how do you treat prostate cancer patient hormonally?
Well, it's, look, nothing's easy here. Nothing is the same with every patient. But, I do my workup and then I talk to them about it. One of the things that helps, and I'm sure you'll agree with me because you and I have talked about this, is progesterone is incredibly beneficial for both men and women, and for women with breast cancer and men with prostate cancer, and there's no contraindications to that one. So for men, I will treat a man with testosterone who has prostate cancer, but I make it clear to them that there is thoughts out there that testosterone will worsen and cause prostate cancer, even though that's been debunked recently. But I treat everyone as an individual, and I'll use it as I see fit with them, and as long as they're willing to walk down the path with me, and I make it clear to them, look, there's no guarantees with any of this stuff. I don't have a crystal ball.
There's never guarantees for anything in life. So how do you give men their progesterone, and what's the reference range or average of dosage that you give to men?
I mean, most men 10 to 20 milligrams of progesterone gives them, a nice boost in their libido, and their brain function gets better, and they like it. And, I start men in their middle aged, and sometimes I'll use a little bit more if they have prostate or other hormonal problems. But, around 10 to 20 milligrams, depending on the size of the guy. Do
you do it as a cream or as a facial cream, or you put it in the injections with the testosterone, or how do you do it?
Sometimes I do it with testosterone injection. Sometimes I'll put it in testosterone cream. Sometimes I'll just have them use separate progesterone pills. And it works. The cool thing with progesterone is it seems to work whatever way you give it to them. It's a pretty simple, safe hormone to use.
It's funny because I consult all over the world, and then I give people guidelines to work with their medical providers. And when I mention progesterone for men, oh my God, the response that you get, their own providers have never heard about it. They don't understand that men and women make progesterone inside your brain when you're younger to protect your brain. And one endocrinologist said to one of my female patients, "You're on progesterone. I'm shocked you don't have cancer already," confusing progesterone, natural progesterone, with the synthetic progestins, which have been proven to cause growth of pre-existing cancer cells. But that's not true with natural progesterone.
No, it's not true. I remember, Lindsay, was after treating my dad, I started learning about the hormones, relearning about the hormones. I was taught in medical school basically about Provera. I wasn't taught anything about natural progesterone. I don't really recall it even being mentioned. And I remember it was shortly after I started using these natural hormones, a chiropractor called me and said, "I'm interested in sending this patient to you. I think she needs natural progesterone." And I said to her, "Oh, I prescribed progesterone before." She goes, "What kind are you using?" I said, "Provera." And there's a long pause on the line, and she says, "You do know that's different than progesterone, don't you?" And I'm like, I haven't studied this one yet. This is the beginning. And she said, "You need to get this book by John Lee." And I got the book. I educated myself. I moved on from there. And so, I've learned that there's a difference between progesterone and Provera. And I wrote about that in my book, The Miracle of Natural Hormones.
So John Lee and Dr. Zava, who owns ZRT, the hormone saliva testing company, the three of us lectured one time in Phoenix. It was like lecturing in front of a football field. There were 6,000 women that were there at this lecture, and it was John Lee and David and myself. Different David, not you. It was really, really interesting. And this was years ago, and still the message isn't gotten out. But what's makes me crazy. So the CEOs of the company that made Provera and Prempro, which is a combination of Provera and medroxyprogesterone acetate, the synthetic progestin, with Premarin, those dudes were bad-mouthing bioidentical hormones along with the North American Menopause Society forever.
They still are. As you know, NAM still comes out with their stupid statements every once in a while.
They're their consensus statements. But then, because bioidentical hormones are catching on, the sales of the other hormones are going down, these CEOs created a company called Medical Therapeutics, created their own bioidentical patented product, micronized oral version called Replenish. They're finishing up their phase 3 testing with the NIH, and now they're publishing in papers. I think I might have sent you one showing that bioidentical hormones are better, safer, more optimal. Now it's going to be great because now they're selling that one. So follow the money, and women are always at the bottom of the totem pole.
It's true. And it's just dumbfounding to me. I've had all these stories over the years of doctors, criticizing my use of, natural progesterone. And, then of course, then I sent them an article on Proveris showing that it increases breast cancer and blood clots and things like that. And they had no clue and whatever, just the same story we've been talking about. And I can assure you in medical schools today, there's no difference from when I was in medical school 30 years ago. They're still taught the same thing, just only synthetic things. They're not taught about any of the natural things.
I don't understand it. So have you at all used the final metabolite of estrogen called 2-methoxyestradiol? Have you used that in your practice?
Well, you've been prompting me to use that in my practice. No, I have not used that yet. I have read about it, and from you, and then that's one of those things I read about and I get excited about it, and then I forget about it. So you're reminding me again. So let me hear your experience with it.
Well, when I worked in Oklahoma, along with that internist, we together utilized it on hundreds of patients. And I'm going to tell you one of my patients now, but Jonathan just called me up, Dr. Wright, who's been both of our mentors. He just had a patient come in that had sarcoma, and all that patient did was 5,000 micrograms of 2-MeO a day. That's all that patient did, and he went into remission, and he wasn't sure how to slowly taper down, and that's why he went in to see Dr. Wright. I have had so many incredible experiences myself. I've been on it when I kept having repetitive tumors, some of them cancer, some of them just regular growth out of control. And I've been on it for a very long time, but right at the moment, it's really hard to get. It's just the pharmacy where I was getting it about 2 months ago stopped selling it. And I called up the FDA and they said that they're missing a monograph on it. So I said, what do I need to do to write that monograph? And they said, you have to be a researcher. So I became a researcher with a very specific research fellowship, and now I'm going to look for guidelines on how to do that, but I haven't done that yet. But give you one example, a patient that I met when I was in Tulsa was diagnosed with an early stage uterine cancer. And she had a very squirrely health history where she'd had a surgery and it took her a very long time to recover. So she was adamant that she didn't want to get a hysterectomy. Now, she should have gotten a hysterectomy. I believe it should have been integrative treatment with a hysterectomy and the natural treatment to prevent recurrence. But she didn't want to do that. So and we made her sign massive papers of release to protect ourselves, went ahead and did little vaginal suppositories of progesterone and 2-MeO. That's all she did. And she kept getting ultrasounds of her endometrial stripe and her cancer markers. And within about 6-7 months, she was free. And she even then went on to get multiple biopsies. So now I just heard from her this week, which is why she's on my mind. It's now been 5 years later. She's been totally cancer free. Most of her family is into medicine and we're totally angry at her and thinking she's just going to kill herself. And she told me that last week, one of her cousins that's an oncologist introduced her to another person as one of the smartest people in their family, because look at it, she obviously has secrets to keeping herself well, but she's concerned because the 2-MeO is not available now. So we're trying to get access. We found a source in China, but then had to have it tested for contaminants, and it was free, and we're waiting to get that in. But, the FDA keeps making things harder and harder for compounding pharmacies when we find these things that work. But I have been on it for about 18 years. It stopped me from having tumor madness. This is the first month that I've been off of it in 18 years, so I'm actually riding a little bit nervous till I try and help to get things sorted, to get a source available for myself and other patients.
Well, as you know, if something works in our realm of medicine, the FDA usually doesn't like that. And, we end up having to fight the battle to keep it available. And, it's what we've been going through for 25, 30 years and more, before my time.
It's just incredible. I don't understand it. So talk to us. You're also known as the iodine doctor because of all of the benefits of iodine for hormonal issues. Can you tell us a little bit of what iodine has to do with hormones and how people might consider assessing their iodine levels and supplementing their iodine levels?
So after treating my dad with thyroid hormone and testosterone, he got better. Every patient got a whole hormonal workup, particularly focused on thyroid. So I started to find a lot of thyroid problems, particularly hypothyroidism or an underactive thyroid. And I found in the first 10 years of my holistic practice, probably about 2/3 of my patients were on a small amount of thyroid hormone. And it was bothering me that I was making that diagnosis on so many people. and why, 2/3 of my patients have to take thyroid hormone to feel better. And they were feeling better. I mean, the therapy was working, but, we weren't designed to become hypothyroid just because we're humans and we're getting older. A percentage of us are, but perhaps, but not 2/3 of us. So over the years, I would look at the thyroid, look at the biochemical pathways and the physiology of it, and look at the cofactors that make it run and make it convert from inactive to active thyroid hormone. I would test my patients on that and try various things. And nothing worked as well as putting them on a little bit of natural thyroid hormone. I mean, you've seen the therapy work. It's can make really dramatic improvements in people, change their lives around. And I was happy with the results, but I wasn't happy that I was having to prescribe so much thyroid hormone. So I would look at the cofactors for thyroid and what stimulates the thyroid gland to work and convert to an active form. And iodine always comes up because the highest concentration of iodine is in the thyroid gland. You can't make thyroid hormone. In fact, you can't make any hormone without iodine in any gland.
Right.
But the thyroid gland, which sits here, weighs about 1.5 ounces. It produces about a teaspoon of thyroid hormone for a year. So little variations in that teaspoon have big effects on the body. And the majority of that teaspoon is T4, or an inactive thyroid hormone. The 4 refers to 4 iodine atoms attached to the thyroglobulin molecule. So this thyroid hormone, this T4, gets released into the bloodstream from the thyroid gland and has to convert to T3 elsewhere in the body, and that's what sort of drives the metabolic rates and the cell function and gets things moving the way we want. So I remember I would try vitamin A and zinc and magnesium and other things to see if I could get the thyroid gland working better, not having to need thyroid hormone, and nothing gave me the benefits. So I would try iodine over the first 10 years on and off. Now, at that first 10 years, there was really no good test for iodine. And then I would get frustrated because it wasn't working. I go back to thyroid hormone and I would come back to it a few years later and try it again. And I was interested in iodine because my practice is in Michigan. We're in the Goiter Belt of the United States, which borders the Great Lakes. It's Michigan, Indiana, Illinois, Ohio.
Right. We're both graduates of the University of Michigan, right?
Oh, yes. And so my soil has been known to be one of the most iodine deficient areas of the entire world. In the early 20th century, there was a big goiter epidemic in the Midwest. And the government rectified that epidemic by recognizing it was caused by iodine deficiency and putting iodine in salt. And so, there's been literature showing that the soil where I live is low in iodine. There's no reason to assume it's different now. With all our over farming and over pesticide use, it's going to be worse now. Like all the minerals have gone down and vitamins have gone down in our food over the years. So, why aren't people deficient in iodine? No one's prescribing it. I didn't learn anything about it in medical school. And, in the first 10 years, pretty much nobody was using it for anything. So I would go to conference after conference and learn things and try things. And I was also a big reader, and I've always been a huge reader. That's how you and I met, because I read your book, The Hormone Deception, from the 1990s, somewhere in there, right?
Right.
It was in the 1990s. Right. And so I was getting the Townsend Letter back in the early 90s.
I still write for the Townsend Letter. I have an article coming out on sleep just this week.
I still get it and still read it. And I remember the year was about right around 1999. And I was reading the letters to the editor, and a doctor had written in about he had developed an iodine test. It was a little 2-paragraph letter, and that's all. And he just was talking about this iodine loading test that he was designing. So I called him up.
Who was this?
Dr. Guy Abraham.
Okay.
The most intelligent man I've ever met. He had so many patents on hormonal testing, I can't even tell. That's another story we can talk about. But he was a genius who was an OBGYN and developed all the hormone testing that's in use today in the 1950s and had patents on it all for estrogen, progesterone, testosterone. And he was busy at UCLA as a clinical professor and doing research, and he didn't like medicine in the 1970s and what he was doing. And so he liked nutrition. So he basically quit his practice at UCLA. And the chairman said, what are you going to do? And he goes, I'm going to go make vitamins for people and make them healthier. Chairman goes, how are you going to do that? He goes, I don't know, but I don't like what I'm doing here. So he left. He started just manufacturing vitamins in his garage. And that's how he started. And so he wrote this article that he would develop an iodine test. And I called him. And Dr. Abraham is a very cautious man. He didn't trust people. He felt that people had taken some of his work and not attributed it to him and then used it in ways he would.
I've had that happen. I'm sure you've had that happen.
Yes, I have. So he was really cautious on my phone call, and he was really he's no longer with us. He died about 2 years ago, but I consider him a dear friend. So, but at that time, on those first phone calls, he was really rude to me, and he didn't trust me. And I just called to say, hey, I'm interested in this test. And he said, he was cool with it. And he said, I'll send you an article. So he sends me the article that he wrote about developing this iodine test. And the article was very technically written, very hard to read. And there were parts of it I was thrilled with it. I thought, hey, this is really something. I know the information's here. I just can't see it yet. I read the article, I don't know, 5 to 10 times. And I kept calling him. And there was one section of that article I couldn't get. And I knew the information was in there. And he would explain it to me. And then he would say, and he'd basically hang up the phone. He was done explaining it to me. There, now you have the information, click. And I'd read it again. I still didn't get it. And so I would call him. There was probably 4 or 5 phone calls. And the 5th phone call, he says to me, Dr. Brownstein, I've explained this to you numerous times. I don't understand why you can't see this. I'm like, Dr. Abraham, I can't tell you why I can't see this. I don't know. But if you could explain it to me one more time. So he explains it to me again. Click, goes the phone. He hangs up. And I remember I'd sit in my office. My 2 partners would hear me on the phone. I'd hang up and I'm like, I tell these guys, I can't believe the abuse I'm taking from them. And they're like, well, why are you taking it? I'm like, because he's a genius. I know it's there. I just can't wrap my hands around it. So I went to go lecture at a conference in Hawaii. I was flying over the U.S. to San Francisco to connect. I'm on that flight. I was reading the article again for maybe the 20th time. I don't remember. And I got to that section and it just clicked. I got it.
What did you get?
So it's hard to, I could show you when we're together. It was a graph and it was just, what did I get? I got that the more iodine that you give somebody, the lower, it was a graph, the lower radioactive iodine uptake is in the body. As you would expect, iodine will take the receptors up, radioactive iodine wouldn't bind to it. And the more iodine you bind to the more iodine you give them, more binds to the thyroid gland, up to 600 micrograms a day was the maximum. It was this graph with this logarithmic scale. It was just, for me, it was hard to get it. I don't know why. It took me 20 times, but it did. And so I'm in the airplane, sitting next to my wife, and I'm like, I got it. I know what he's talking about. I said, this is going to revolutionize my practice. We get to San Francisco. This was in the 90s. I find a payphone. Remember that? I don't think I had a cell phone. I called from a payphone. First, I called Dr. Abraham, and he takes the call. Yes, Dr. Brownstein, do you need me to explain it to you again in this sort of sarcastic tone? And I'm like, no, I got it. I said, I know what you're trying to say. I'm sorry it took me so long. But I said, we've got to meet. I said, this is going to totally change medicine. And for me, and I said, it's going to change medicine for the world because I'm going to write about it. And he said, you haven't even used it yet. I said, I don't need to use it. I can see from this information that you've got, this is what I've been looking for. So next phone call was to my partners from the airport. And I said, guys, we're going to put your boots on. I said, we're going to be changing things of what we do. And, I'm really excited about it. And started using it in my practice. And Dr. Abraham taught me, why the way I was using iodine wasn't working and how to use it correctly and the form to use it correctly.
So how do you use it correctly, and what is the correct form?
My first 10 years, I was using iodide, DIDE, the reduced form of iodine. And I could give small, medium, large amounts. It didn't make a difference. People didn't get worse. They didn't get better. It was only when I used a combination of iodide and iodine that it worked. And it was Dr. Abrams' premise that was the best form to use. And, since doing that, I've wrote my book on iodine. It's in its 5th edition. And it's of the one thing that's changed my practice, my holistic practice more than anything else from the start is that.
How has it changed it? What does it do for patients?
So 2/3 of patients that were on thyroid hormone the first 10 years of my practice are down to probably 10 to 20%. 10% maybe are on thyroid hormone. I don't need to use thyroid hormone as much. You give them iodine, which like I said before, you can't make any hormone in the body without iodine. I have healthier patients. I have happier patients. The second major concentration of iodine in the body next to the thyroid is the breast. However, iodine concentrates in all the glands, the ovaries, uterus, pancreas, prostate. What are we having problems with? All these glandular tissues. We got 1 in 7 women with breast cancer, 1 in 3 men with prostate cancer. We got epidemic increases of all the other glands, thyroid, ovaries, uterus, prostate, pancreas. And my premise has been that the reason we're having so many problems with these glands is it's iodine deficiency. Iodine's main job is to maintain the normal architecture of the glands of the body.
Does it also, besides maintaining the parenchyma, the architecture of the gland, a fibrocystic breast screams that it's insufficient in iodine or thyroid function. But is it true that the hormone also rides piggyback on the iodine through the lymph system and it helps clear hormones out? So it prevents hormones from excessively accumulating in tissues that can put you more at risk of issues in your tissues?
Absolutely, 100%. And iodine is a great detoxifier. But let me come back to the glandular tissue. In the glandular tissue, so iodine maintains a normal architecture of the glands. In iodine deficiency, the first thing that happens is you get cysts. Next thing that happens is if it goes on longer, the cysts become hard and nodular. If it goes on longer, the tissue becomes hyperplastic, which is a precursor to cancer of that tissue. In animal test tube and humans, iodine has been shown to stop that progression and reverse it. So is iodine a standalone therapy? Maybe we're hinting at that with that. No, it should be used as part of a holistic treatment regimen with balancing the hormones, with correcting nutrient imbalances, with detoxifying. And iodine's a great detoxifier.
How does it do that?
So it does it by, number one, competitive inhibition by the other halides that are in the same pathway as iodine, bromide and fluoride. We're in our world, we're exposed to an excess of bromide and fluoride. These are terrible chemicals that shouldn't be in our environment. Bromide is used as a fire retardant in way too many consumer goods, from mattresses and computers and iPhones to couches and curtains. And of course, I'm looking around this house to see what else has bromide in it. Fluoride in our water supply and in our medicines, as a chemical constituent of a bunch of antidepressant drugs and antibiotics. It's a disaster. And iodine, you give enough iodine, the body will kick out fluoride and bromide.
Minerals are such protectors. They really help protect us from a lot of the pollution in the environment.
Yep.
And iodine's a mineral. It's one of the protective minerals.
And conversely, if we get too much bromide and fluoride in our environment and we're iodine deficient, guess what's going to bind to all those receptors? It's going to be bromide and fluoride. And that's not a good thing for our body. So that's one of the best effects of iodine. And it's also a detoxifier for some of the heavy metals. I've seen people for mercury and aluminum and cadmium and lead, start pouring out those toxic items when they go on iodine. Maybe it doesn't work for everybody that way with the heavy metals, but there's an old article from the 1930s titled "The Chaotropic Effect of Iodine." You ever heard the word chaotropic?
Is that like a chelating action?
It's spelled CHAOTROPIC. I had to look it up. Uh-huh. And they don't really talk about it chelating because it doesn't bind. They talk about it displacing and allowing the body to push it out type thing.
Competitive inhibition.
A little bit, but it's this nebulous chaotropic term that was used.
How do you spell that?
CHATROPIC.
I always learn a lot talking to you. Always.
So that was a really cool article. And so it's been a great treatment. And one of the ways that you can maximize iodine in the body is to use salt with it. I can tell you, people are salt deficient. Most people are salt deficient. We've been raised with this idea that salt's bad for you and salt causes hypertension. We need to minimize salt. We have too much salt in our diets. That's just wrong. The salt is the second major constituent in the body next to water. We need salt in our body. When we don't have enough salt, we are salt deficient. We have no stores of salt, so we got to take it in on a daily basis. And the laboratory testing for sodium and chloride levels are too large. It should be much smaller. So it's my premise that sodium should be over 141 milliequivalents per liter and chloride above 105. And if you're below that, you're deficient, even though the range includes, much below that. So salt helps the body to, when you give iodine, you get fluoride and bromide mobilized. More salt will help to push out fluoride and bromide safely.
You've even treated people with hypertension with giving them more salt, and then their high blood pressure normalizes.
When they get the right kind of salt, which is unrefined salt. I wrote my book, Salt Your Way to Health, because salt had worked so well in my practice, and it works well synergistically with iodine. It's really, again, you want to talk about what works, that's what works.
So what kind of salt do you recommend? Because, there's all that latest literature that because the ocean is so filled with these icebergs of plastic that a lot of salt has microparticles of plastic in it. And they said the one salt that didn't is real salt. Actually, my grocery store here sells it. Is that what you recommend? Or what's your recommendation now, David?
I've had real salt, I've had Celtic salt, and I've had Himalayan salt tested for toxicities 4 times. They all tested clear. So I think any of those 3 are fine.
Himalayan, Celtic, and real salt. And many of these now you can get at your even local grocery store.
Yes. And yes, the oceans are the way the Celtic salt is collected is they have these farms in northwest France where they rake the salt into a clay-lined pot, and supposedly the toxins are supposed to be dissolve out as the sun evaporates the water. All I can tell you is I had it tested 4 times and it looked clear. I found great results with my patients with using that. And so pretty much everyone's on at least a teaspoon of salt a day.
So how do you test for iodine in your practice?
I don't test as much anymore because between me and my partners, we've tested over 7,000 people. 97% tested low, most of them severely low. So I didn't want to test everybody for something that I felt everybody was low on. And when I get criticized from some of my natural colleagues who, why aren't you testing people? I always ask them, are you testing everyone for vitamin C or magnesium before you put them on it? I don't think we need to test everything under the sun. So I sort of pick and choose now who I test for it. But how do I test for it? The best test is what Dr. Abraham developed, the iodine loading test, where you take 50 milligrams of iodine, collect 24 hours of urine afterwards, and you're looking at how much of that 50 milligrams stays in the body and how much pees out. And you can just subtract the numbers. And, if a healthy person, once their body's saturated with iodine, should have 95% saturation, meaning out of a 50 milligram load, you should pee out 45 milligrams and hold on to about 5. If you hold on to more than that, generally that's a signal that you need more iodine, that your body's more deficient of it.
So how do you address, and I know you know who I'm referring to because he's another close friend of mine too, and you guys you don't have an agreement there about, he's worried that iodine will suppress your thyroid activity. And this is what a lot of people, the people who don't believe in what you're saying, and you have a very cogent reply to that. So I'd like you to address the safety of iodine supplementation for thyroid functioning.
My first snarky reply to that is maybe I have different patients than everybody else out there. Because between me, my 2 partners, my PA, and my nurse practitioner, who are all seeing patients, we don't see that happen. Now, the reason it's called iodine-induced hypothyroidism. The reason that's in the literature is the researchers will give a group of patients iodine. They'll measure the thyroid hormones and they'll see TSH go up. And as soon as TSH goes above the reference range, they'll say that's hypothyroidism. Iodine's causing this hypothyroidism. Therefore, they termed it iodine-induced hypothyroidism. What they don't say is if they looked at the T3 and the T4 levels, the other thyroid hormone levels, those are usually normal. What they don't say is if they ask the patient, how do you feel? The patient's going to say, generally, I feel better than I've ever felt. I got more energy. My brain's clear. And they're clearly not suffering from hypothyroidism, even though their TSH has gone up. So what's the reason for that? The reason for that is just to look in the literature. When we take iodine in, iodine has to be transported by a particular what do you call it? I call it a taxi cab in the body called sodium iodine symporter, NIS, that moves iodine from the bloodstream into the cells where it's needed. Now, the stimulation for the body to make these taxi cabs, the sodium iodine symporter, it needs TSH as a signal to do that. So if you're low on iodine, your body's not stupid. It's not going to have these taxi cabs waiting for iodine. It's only going to make them when it needs it. So soon, the first thing that happens when you take iodine is NIS will go up. The stimulation, TSH will go up, TSH will go up to start stimulating those taxi cabs to move iodine into the cell. So I call that a normal and expected response of iodine supplementation. It'll last 3 to 6 months until iodine gets saturated inside the cells. Once that happens, TSH comes back down to normal. That's how it works. That's in the literature. I wrote about that in my books.
Yeah, your books are really great, and you can go to Dr. Brownstein's website. We'll have his link in the show notes because we want you to get his books. He's a real pro at writing amazingly complex information in a very simplistic and enjoyable way, and you get it really quickly. And so we'll have all that information. Can you tell the different tests? You know, most doctors out there are still just ordering TSH to evaluate thyroid function. And we know, as you said earlier on, you started ordering other tests. So what are the basic tests that you order for evaluating thyroid functioning?
So, again, you start out the beginning saying, hey, let's talk about what works. So 25 years ago with my dad, I was taught in med school, just order TSH.
Right. Thyroid stimulating hormone. That's what most doctors order if you go into them.
Comes from the pituitary gland, and it's supposed to stimulate the thyroid to make thyroid hormone. If that thing's abnormal, they got a thyroid problem. If it's not, it's normal. Well, that's not quite true. I mean, you could have enough TSH, and if the thyroid doesn't have enough iodine, it's not going to make enough thyroid hormone. And you're telling the patient, hey, TSH is normal, you don't have a thyroid problem. Well, you do. If you just measure T3 and T4 levels, you'll see those are low. And so what, the TSH is normal? They're still not making enough thyroid hormone. So I think they need a whole thyroid panel.
So what is your whole thyroid panel?
So it's TSH, which I think is a good test order, but not alone. A free T3, a free T4, thyroid antibodies, both thyroid antibodies, thyroglobulin and TPO antibodies, and reverse T3. And then when you look at how all these work, and for new doctors, what I do is when I do my thyroid lectures, I teach them how all these work and how to evaluate them. You get a much better picture of what's going on with the thyroid than just using TSH levels.
I know this is a rhetorical question. I know I'm saying this to the choir, but endocrinologists battle us against evaluation of the thyroid like this. I remember once I was lecturing with Eldred Taylor, and he said the most stressful lecture he ever gave in his entire life when it was, he was shocked that he was invited to lecture in front of an endocrinology association. But he started talking about ordering reverse T3, and everybody started walking out of the room en masse. It was an exodus out of the room. Why is so we're never going to go lecture in an endocrinology.
They would not like that.
Why is there such resistance? I remember 40 years ago when we started running hemoglobin A1C, everybody balked at that. Nobody who was a regular PC wanted to run it. They said, you don't need to look at it. You should only need to look at the glucose. Well, now everybody runs hemoglobin A1C and even fructosamine, which is a shorter look at the blood sugar. So a lot of things that first come out are poo-pooed, but now this bigger screening panel to assess thyroid function has been here for a while, and endocrinologists staunchly dig in their heels. What's the story?
What's the story? What you're going to have to ask an endocrinologist. But The one good thing with endocrinologists is when I was in med school, they just ordered the TSH. Now they're ordering a T4 with that TSH. So they have changed a little bit. They are some of the most difficult doctors to deal with. That's been my experience. And what's the story? I don't know what's the story, but it's a story of medicine. Medicine's never easy to change. Medicine doesn't like people telling you to do things differently. Doctors, generally what they learn in their residency in medical school, that's what they do for the next 30 or 40 years.
Even though the body of literature changes every 6 months.
With very little changing, that's what they do. And I remember in my med school graduation, the dean saying to us, we just taught you the latest and greatest of what's in medicine. You're ready to go out there and do it. He says, but you're going to find out 10 years from now, at least 50% of what we taught you was totally wrong. The problem is we don't know which 50% it is. You're going to have to figure that one out. And I remember leaning over to my friend going, I worked this hard and they just taught me 50% wrong. Now I would say it was more than 50%. It was probably 80% was wrong. And, you know, I'm still trying to figure out what else they taught me was wrong. But one of the things was wrong was just check the TSH level. That's a really poor way to evaluate someone for the thyroid.
You know my whole history in my journey with keeping well over the last so many years. And I go to my eye doctor now in Salt Lake City, who's now going to be coming here to the Dell new eye med school and setting up the eye curriculum. And he's starting to test for transforming growth factor beta 1s, galectin-3. He's starting to look at those things, look at ozone intervention. And he said med school is a waste. It's a waste, but you have to have it to go forward. And it changes every 6 months. And he said it's just really a sin because we're treating the eyeball, but not the body that owns the eyeball. And we see this over and over again, yet the patient goes, well, then who do I go to? And who do I listen to? That's why we have shows like this. And thank you so much for giving us this hour on your vacation in Barbados.
That's why I started writing my books, because, you know, I wanted patients to have a source so they could see what I'm thinking and where I think the literature goes. And I cite it all. And I try and make it simple enough for people to read. The best patients are the most educated patients. They can make their own choices and make better choices with things.
I love to hear a doctor say that, because a lot of doctors don't like that patients go to Google and look at everything and then bring in all these papers. It's intimidating, because it used to be that medical doctors, part of their one-upmanship is that they owned all this data. And now this data, we have portals to this data as a regular person out there. But it's so great to have you on the show. I love you deeply. You've been there for me, and we're on the same page. We're mishpucha is the kindred spirits is the Jewish or the Yiddish term for that. And you look fantastic. I know you walk your talk. You have a whole little basket of blueberries a day. You tell me that you have a great coloring and your teeth are white. I mean, you just, I don't really, every now and then, David, somebody, an agent will get in touch with me to want to get her client on my show. And then they send a picture of the person who wants to be on my show. And they obviously don't walk their talk, and I can't have them on this show. I mean, because you and I definitely are impassioned to live it as well as share it.
Absolutely.
Thank you. Yeah.
And it's been great. It's been great. We've had a great relationship, and you've been there for me as well, dear.
Oh, thank you. I can't wait to come out and see your new home on the lake in Michigan and hang out with you guys. Where?
Come in the summer.
Yes, you keep telling me that. Yeah, I'm going to come in the summer. So thank you for giving us time on your vacation. Is there any final thing that you want to say? And we'll put in all the links where people can get to your books, because that people should be buying your books. And I'm going to send you it's going to be done in a few days, my new free ebook, which I've written in a way to completely review the science of what testosterone does for the breast and the prostate and how it can be used in an oncologic patient. What's the science? And I wrote it in a way for a patient to be able to hand it over to her oncologist. And what was interesting is that my editor that's edited my last 10 books, got breast cancer a few years ago, and she was editing this ebook last week, and she had her follow-up visit with her oncologist. So I'd requested that they measure the molecules of mass destruction, galectin-3, et cetera. She'd never heard of any of those and poo-pooed that. But she started to read the testosterone. I got an email. Oh my God, thank you for sending me this information. I had no idea this is going to be a game changer in my practice. So I can't wait to send it to you.
I can't wait to read it.
So have a safe travels back to Michigan tomorrow. And
Will do.
Thank you so much for being on the show.
Thank you, Lindsay.
Bye, everybody.